Welcome to today's webinar, The Recipe for Health, How to Nourish Your Mind, Body, and Soul. Thank you for joining us. My name is Laura Crone, and I am the Project Manager for Research and Education at the Advocate Medical Group Adult Down Syndrome Center, which is in Park Ridge, a suburb of Chicago in Illinois. Next slide. And next slide, please. We are a healthcare clinic for adolescents and adults with Down syndrome, ages 12 and older. Since opening in 1992, our healthcare providers have seen over 6,000 patients with Down syndrome. In addition to providing patient care, we offer a variety of research and education opportunities, such as this webinar and our online resource library. Next slide. Our online library contains over 500 articles, visuals, videos, and other resources related to health and well-being of individuals with Down syndrome. You can access it free of charge at the link on the slide, and Dr. Chicoine will refer to it throughout the webinar. Next slide, please. Before I introduce Dr. Chicoine, I have a few reminders. The webinar is being recorded, and the link to the recording and the slides from the webinar will be emailed to attendees within 1 week. There will be several polls throughout the webinar. Responses are anonymous, and we hope you will participate. Additionally, there will be a Q&A at the end of Dr. Chicoine's presentation. Please feel welcome to submit questions throughout the webinar using the Q&A option. We will address as many of them as we can. Next slide. Lastly, please note that the information in this presentation is for educational purposes only and does not take the place of working with your own healthcare professionals. Next slide. The presenter for today's webinar is Dr. Brian Chicoine. He is the co-founder and medical director of the Adult Down Syndrome Center. He is also on the faculty of the Family Medicine Residency at Advocate Lutheran General Hospital. In the interest of time, I'm going to share his full bio in the chat. Thank you again for being here, and with that, I'm going to turn it over to Dr. Chicoine.
Thank you, Laura, and welcome everyone. So glad to be here with you today. We want to start with what is the definition of health? We're going to focus on promoting health for people with Down syndrome today. But let's be all on the same page about health. And so we really look at the World Health Organization definition, and health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Now, clearly, we spend a good amount of time when we're seeing individuals with Down syndrome on addressing healthcare problems, diseases, if you will, whether it be thyroid problems or celiac or many other things that people with Down syndrome might encounter. But really, the real exciting thing and the real hope for what we do is really focusing on health. What can we do to promote individuals' health more than what can we do to actually just treat conditions as they arise? And so that's really going to be the focus today on promoting health and really focusing on what can we do proactively to help people be healthy. So always a good place to start with the expert, and that's a person with Down syndrome. So let's listen to Jeff discuss how does he promote his own health.
Jeff, what do you do to promote your own health?
I am very active and doing things both on campus at Misericordia. Also, I promote my health when I'm at home. I also promote my health when I'm active, and I also promote my health when I'm with my girlfriend Rachel, having a healthy relationship, maintaining my relationship with my mom and dad. I also promote my health by going on the exercise bike, eating my fruits and vegetables, and I also promote my health by being able to to help myself to lose the weight. Also, I have a job at the Mountain, and also I promote my health by volunteering and working at the Adult Down Syndrome Center and doing things at the hospital with Scott. Also, I also promote my health by just, making friends and just enjoying myself and making sure that I'm a popular guy, and that I'm friendly, I'm happy, sometimes I'm sad, but sometimes more than anything overall, I am happy with who I am. I do have Down syndrome, but I am happy because no matter if I had Down syndrome or not, I know that I can have a healthy relationship, and I can also have a healthy lifestyle, and no matter what, I love myself for who I am.
Well, that's pretty much the talk. I will fill in a few details, but Jeff really has really hit the nail on the head, and really addressed much of what we're going to talk about today. And so we're really going to expand on some of the things Jeff talked about, and we're going to talk about uh, a recipe as for health, including nutritious food, physical activity, sleep, stress management, meaningful activities and social connections and social skills, all of which Jeff pretty much touched base on. So of those things, which ingredient are you most interested in hearing about? And Laura has put up the poll there. So if you want, you can just click on one of those, and we'll give you a few moments to do that. Pick on the thing that you're most interested in or most concerned about. We're still going to talk about all of them, but we're just interested in hearing from you. All right. Now, if I remember how to do this correctly, I should be able to close that, I think, and see the results. Is that right, Laura?
Yes, I can end that.
Okay, we'll let you do that. There we go. So pretty much spread pretty evenly across the board. Nutritious food, physical activity and exercise, sleep, stress management, meaningful activities, as well as social skills. So let's dive into those. But let's start with, why do we call this a recipe for health? Well, first off, when each of us are making a food or making a recipe, preparing a recipe, we each have our own personal preferences. Some like a little spicier than others. You might make little changes for yourself that someone else would not make. So again, these are going to be unique for each person and for each person's needs and preferences. We may change a recipe as we get older. What we liked when we were 20 may not be what we like when we're 60. And so we may change that recipe a little bit. And that's true for these health promoting issues as well. And we'll talk more about that in a second. Just like in any recipe, we know that the ingredients we just looked at there, they complement each other. So it's not a one or only one of them. We really want to try to incorporate all these things into our lives in some fashion. And then we also have to be careful, though, that we don't let one overpower all of them. So we focus so heavily on one that we ignore the others. So really does sort of fit in the same concept as a recipe. Now, one thing is there really is not research or data, evidence for all of this in people with Down syndrome. So a lot of this, or some of this, at least some of this we talk about, will come from research or data in people without Down syndrome that we extrapolate to people with Down syndrome, and we'll try to let you know as much as possible when something is specifically data in people with Down syndrome versus something we're extrapolating. Um, but we'll go through that as we talk about each topic. The other thing is a lot of this really is, I'm sure, is not going to be surprising. Hopefully, this is things that much of this you've heard before or read in some other situation, or even come up with on your own as you've gone through day-to-day life. But we do interested in how as we go through this today, hopefully it'll spark some conversation. Now, again, on a webinar, it'll be through the Q&A, but hopefully it'll spark some back and forth and some questions as well as some comments. And we look forward to that part of the session. And we really are interested in hearing from all of you at the end of this presentation. So feel free to jump in, and we'll try to address as many of those as possible. So the next thing before we start with going sort of topic by topic is, how do we encourage people with Down syndrome to participate? How do we encourage any of ourselves to participate in these things? And I think the number one thing is make it fun. We need to do these things that make it interesting and fun, and we're much more likely to participate. And I think that's true for people with Down syndrome as well. And the other thing is start small. And we're going to talk about a lot of things here in a few moments, a lot of considerations, a lot of possibilities, a lot of suggestions. I certainly do not expect all of you to run out of here today and make 700 changes to your lives. If we can just start with one or two, I think that's a good start, and then sort of build on that with time. Or if your other things you're going to do, maybe you'll make little tweaks based on what we say, or little additions or whatever. And so again, looking for small changes and fun. If we can do those two things, I think we're much more likely to be successful. And then for some of the individuals we see, building in this sort of reward system or charts can be helpful. I know certainly for my exercise and my healthy eating, I like to record and I like to keep track. And I know that's one way for me to kind of see where I've been and where I'm going. And so we find that's true for people with Down syndrome as well. Involve others. For many people, we'll just discuss exercise for a second. We'll use exercise as an example. For many people, doing it with other people is really key. It's more fun that way. They're more likely to do it. I remember years ago, at 5:30 in the morning, my running partner would be standing under the streetlight, and if I didn't get up and get going, he was still going to be standing under the streetlight. So there was also an accountability piece to that was really helpful. And then what are the benefits? I think for many of us, hearing that, eating this or that or whatever is gonna, lower my risk for whatever, it may not be quite as motivating as I'm going to feel better, or I'm going to have more energy to participate in other activities, or whatever the case may be. So really, what is it? What is the benefit, and what is the benefit that matters to the individual? They're going to look better for being dressed up in that suit that they're wearing to the dance next week, or whatever the case may be. So really, again, looking at what is important in that individual's life that making these changes can impact, rather than necessarily, somewhat nebulous. You're going to be healthier, 10 years from now. That doesn't always, encourage lots of people. So let's start with nutritious food. So we'll do another poll. My biggest concern about nutrition for my loved one with Down syndrome is he or she, and then just click on one of those if you would. And if you don't have no concerns about nutrition, you're doing great. That's a selection as well. Again, these are all anonymous, so we're not keeping track of who's saying what. All right. So as you'll see in a moment, not surprising that concern about being overweight or obese is the number one concern there. And the rest are all about, pretty close to the same. You're not eating a variety of foods, specific dietary needs such as gluten-free and other, and then about 10, no, 9% or so really have no concerns. So let's dive into those issues. So nutritious food. For first off, we have to eat for fuel. It really gets us moving and allows us to do all the functions of our body. So really focusing on this is an important issue. Unfortunately, from studies, we know about 27% of adults with Down syndrome had a BMI, a body mass index, which isn't a great tool, but it's the tool we have at the moment. It's a calculation based on weight and height. And so we know about 27% of adults with Down syndrome fit into the overweight category, which would be a BMI of 25 to 30. And about 54% have a BMI in the obese range, which is a greater than 30. And so, is the BMI a great indicator of weight for people with Down syndrome? It's has its shortfalls with shortcomings with regards to any of us, but probably even more shortcomings with people with Down syndrome. But it is the tool we have now, and others are looking at doing some modifications to that. But so we know this is a significant problem, just as our poll would suggest that there's a lot of concern about this. And certainly the other issue with regards to healthy eating or nutritious food, in addition to healthy weight and fuel, is the mental health benefits. There's significant data in the non-Down syndrome population about eating healthy foods and the impact that it can have on your mental health. And then the potential for preventing other health conditions. Certainly, we know that issues with regards to diabetes and other health conditions that are so nutritionally generated or provoked. So oftentimes people ask, what is the best diet? Well, that is a great question. Unfortunately, there's not as great an answer. There are many ways to have a healthy diet. Some of the information, again, done in the non-Down syndrome population has not been replicated yet in the Down syndrome population. But a lot of people have been looking at what's called the DASH diet or the Mediterranean diet, or sort of a combination of the two called the MIND diet. And that's heavily plant-based, healthier fats, and fruits and vegetables and seeds and nuts so again, there's more information in the information that will be provided with this. But again, these studies have not been replicated in people with Down syndrome. But we know that there's a lot of health benefits for these in general, and so I think they certainly make sense for people with Down syndrome. So looking at prescribing a diet or given very specific guidelines, sometimes we get asked, particularly for individuals that we see that live in a residential or a group setting, can you give a very specific diet that they should follow? A couple issues with that. One is we often see that doesn't work very well, partly because just how much control the individual has over what they eat based on what's being served, and also the issue of independence. And so if we put really strict guidelines on people in one setting, but then they go eat in other settings where they're not likely to follow these, and sort of look at that like sort of what they call the freshman 15 for kids that go away to college and gain weight when they in the first year, because now that all the restrictions that have been put on them at home are not there, and so they're making their own choices. So we really see education as more of a better way to approach this rather than diet prescriptions, because really the individuals need to have this information that they can use in all settings. And the other thing we find in residential facilities, particularly in Illinois, is the concept of the individual having rights. And so restricting different things like foods really ends up kind of butting up against the issues of rights. And so there, this becomes kind of a tug of war. So really we find, particularly in residential settings, educating the individual with Down syndrome, as well as educating the staff. So we really try to refer the staff to a dietitian along with the individual with Down syndrome, or even better, if the agency has a dietitian on staff, to have that dietitian go into the home and really, work with the individual with Down syndrome and the staff to try to look at better choices. So we want to give people choice, but we want to hopefully we're giving them healthy choices and to help them guide them into eating healthier and making their own decisions, which is an important piece. So what are some of the nutritious food issues that we recommend? And again, sort of fits in with those diets I just talked about. In general, reducing consumption of processed foods is important. There's lots of information, again, studied in people without Down syndrome, but we think that it probably is true for people with Down syndrome as well, that a lot of the processed foods has a lot of additives and things that contribute to health problems and weight gain. We have a lot of folks that have been resistant to eating vegetables, for example. And so mixing them in with pastas or soup or sauces or eggs can be very helpful. Make food swaps, grilled food instead of fried, cauliflower pizza crust or cauliflower rice instead of regular pizza crust or white rice. Zucchini noodles instead of wheat-based noodles works for a lot of people. I remember a number of years ago, my mom said that their daughter was in for an appointment, and the mom said, the daughter with Down syndrome had never eaten a vegetable in her life. And I said, just try a little thing that we used to try with our kids when they were little and were resistant to vegetables. Have her participate in the process. Get little English muffins and put a little tomato sauce on there and put a few little vegetables on there and pop it in the oven and sort of make a mini pizza. And just like with our own kids, the opportunity to participate in the food preparation, as well as mixing it in with other foods, as well as making it sort of a fun little thing, really it worked well at home. And then the next day the mom called me and said, "Oh my goodness, she ate her vegetables for the first time in her life." So again, little things like that. I'm not going to say that's going to work for everybody, but little creative things like that families are doing at home to help make some of these small changes can be really helpful. And then the other thing that's really important is fluids. Few reasons. Certainly, it's been shown that being dehydrated lends us to eat more, as well as tends to cause us to gain more weight by eating. But we also, looking at listening to histories and looking at doing physical exams, and looking at lab tests over the many years that we've been doing this, it's clear that many people with Down syndrome do not drink enough fluids, and they really go through life at least mildly dehydrated. So ideally, if they can drink more water, would be great. A lot of individuals with Down syndrome, or a lot of families tell us, the person with Down syndrome just won't drink water. And so, looking at other ways to work around that, flavored water with fruit, or you can use maybe one of those infusion things where you get fruit into the water. Trying seltzer water or sparkling water. Sometimes that's helpful. Sometimes water with just a splash of orange juice or apple juice or something, just to give it the tiniest little bit of flavor and the tiniest little bit of texture. Sometimes it's almost a texture thing for some people. And then just generally limiting pop and soda, particularly that with sugar in it. Again, I think there's a lot of debate with regards to artificial sweeteners, and I don't think we have a final answer on that. But I think limiting the pop and soda in general, I think, is a good idea, and trying to get the fluids in other ways. And we have a number of resources. Laura mentioned our online resource library, and we have a number of resources specifically for people with Down syndrome on things that they can use to encourage themselves to be hydrated better. And again, we talked about check boxes or ways to keep track. And a number of the things that we have on there can help people keep track of the number of glasses of water, for example, that they're drinking a day. And we have a wonderful video where Julia talks about drinking more fluids and staying hydrated. And I encourage you to take a look at that. Julia is a woman with Down syndrome. And we encourage you to take a look at that and share that with your loved one with Down syndrome, and so that they can, again, sort of take as an educational tool, so that they can really begin to take responsibility for some of this and take this on themselves, rather than us having to tell them to do that. And again, just as I mentioned with the little pizzas, involving the person in planning meals and shopping for preparing for foods really makes them part of the process, and can be very helpful, and helps them learn as well what healthier eating is about. A lot of people with Down syndrome can learn about food labels, and can learn about what some of the healthier choices would be. I've been very impressed with the number of our folks with celiac disease that can really take that on and know what when gluten is in food and what they should and shouldn't eat. So we see a lot of people with Down syndrome, when given the opportunity to learn about healthy nutrition, can really do a wonderful job with that. There's some apps and other visuals that can be very helpful. You can see the red, yellow, and green food guidelines. There's a number of those available that really help. The foods that are less calorie dense and more nutritionally dense. Typically, the greens, you'd really want to eat more of those, and limit not eliminate the reds, but limit the reds. The foods that are more high calorie density and less nutritionally dense, the sodas and the donuts and things. Those would be things you'd want to eat less of, and more of a treat rather than an all the time. And then portion control can be an issue for any of us, but certainly can be an issue for some folks with Down syndrome. Some folks with Down syndrome do seem to have difficulty with really kind of understanding that they're full, or that they're feeling that sensation of satiety, that they don't need to eat anymore. And so really sort of helping them, here's a reasonable portion, and that can be a portion plate. And there's a lot of other ways. And we have a wonderful video on our webpage where two gentlemen with Down syndrome, just from their body parts, their fist or their palm or their thumb, things that you can use as sort of a rule of thumb, so to speak, a sort of a guide towards, how much is a healthy portion for different types of food. So real helpful video, and I really like to share that one with the individuals we see at our clinic as well. And then what parts of the meal, are better to have seconds, rather than, eating the seconds of, the starch or the meat. Perhaps we're going to have a little more fruits and vegetables as seconds when we do still feel hungry. So again, we go back to, rather than real strict guidelines, really having, education and really helping people build into their lives that they can take control over this. And again, as people with Down syndrome get more and more independent, they're going to need to have these abilities and this information, because they're out in the community making their own decisions, and hopefully we can help them make healthier decisions. So the next topic is physical activity. So we'll do another poll. My biggest concern about physical activity or exercise for my loved one with Down syndrome is that he or she, so jump on, does not want to exercise, does not exercise enough, lacks access to fitness opportunities, other, no concerns. Another few moments. All right, let's see how you did here. So again, two of them sort of that does not want to exercise or does not exercise enough, really were about 2/3 of the answers. And then about a quarter of folks had no concerns, which is great. Hopefully that means people are exercising. And then the opportunity and other would be about 10%. So let's jump into those and let's tackle those. There we go. So again, a lot of this data is from people without Down syndrome, but again, I think we can extrapolate at this point. And again, because physical activity has so many benefits in all of us, unless we find otherwise, at this point, we would continue to recommend the similar guidelines as with other people that don't have Down syndrome. But certainly, in studies in people with Down syndrome, it has been shown several times that physical activity can improve cognitive function and memory. And so really very important with regards to, we're doing so many other things to try to help people with their cognitive function, their skills, and their memory. And we really want to make sure we're not overlooking physical activity, which we know also improves cognitive function in any of us, but it has been demonstrated in studies in people with Down syndrome. We've talked about how it can help with healthy weight. It can have lots of mental health benefits. Again, more studied in people without Down syndrome than in people with Down syndrome. But we know that, for example, there are studies that show in mild depression, physical activity, regular exercise can have as much benefit as medications. And so I'm not necessarily saying one or the other in some situations, but maybe in some, but maybe not at all. But certainly as an adjunct, we don't want to forget, as we're promoting someone's mental health as well as their physical health, we want to make sure that we're also looking at physical health, which because it's in physical activity, because they're so intertwined. And so really very important to encourage people to be physically active. And then certain prevention of other health conditions. And we talked, obviously, there's a link between inactivity and diabetes, for example, and obesity and arthritis and other things, lots of other conditions. But clearly the big one in people with Down syndrome, unfortunately, or fortunately, depending on how you look at it from a positive standpoint with exercise, would be the possibility that exercise could help prevent or delay Alzheimer's disease. And there are some data in the non-Down syndrome population that supports that. Again, not replicated yet in people with Down syndrome. But I think very important to consider that, unfortunately, because, fortunately or unfortunately, I mean, how you look at it, that Alzheimer's is so common in people with Down syndrome. And so we really, whatever we can do to try to either stave that off or delay it or prevent it would certainly be important. And physical activity does seem to be, at least in the non-Down syndrome population, seems to be one of those things that has a huge impact. So again, something we really encourage in the individuals that we see in our site. And that, physical activity, how much? The general recommendation is 30 minutes, 5 times or more days, or 5 or more days a week. For those that are really trying to include exercise as part of their weight management or weight loss program, it should be more than that. Actually, I just read an article this morning that suggests, probably closer to 5 or 6 hours a week. So we're, looking at 45 to 60 minutes a day if we're trying to include that in our weight management part of our health. And then incorporate different types of exercise. For so long, exercise was really aerobic, running, biking, swimming, that kind of thing. But we know that it's important to add some strength training. Really, again, I was reading this article this morning, and it was talking about, so much of the benefit of exercise with regards to weight management is that it helps build up muscle. And with muscle buildup, it increases our basic metabolic rate. So the amount of calories we're burning when we're just sitting, the more muscle we have versus fat, the more calories we burn when we're not active. And so regular exercise, including some strength exercise. Now, I'm not suggesting everybody should go out and, be bench pressing 500 pounds or anything like that. It could be light weights. It could be stretch bands. I think stretch bands are wonderful because oftentimes you can do some resistance training as well as stretching simultaneously. And then you can also use them as part of a balance program. We know that many people with Down syndrome have impaired balance to some degree, that they're a little unsteady on their feet. And trying to work on improving balance. And again, I was reading a couple articles yesterday that studies have shown that programs that include balance in part of the exercise regimen for people with Down syndrome can improve individuals with Down syndrome balance. So it is a thing that can be improved upon and changed. And certainly we know that balance has a lot of implications with regards to injuries and if you have poor balance and other health issues, And so again, balance is such an important thing, particularly as we get older. Just naturally, as we get older, our balance diminishes, and so really trying to keep on top of that and keep ahead of it is so important, whether you have Down syndrome or not, but certainly for people with Down syndrome. NDSS, the National Down Syndrome Society, has a nice program called 3-2-1 Go, which I encourage you to take a look at. And then, sometimes individuals will say, they have more difficult time, doing activities up and about, moving around. And there are a lot of seated exercises that you can do that, are also can be very effective. And so we have a link to a video there. Neither one of those we developed, but the both excellent programs. And again, the other thing is sometimes people talk about, what's the target heart rate? And so actually the target heart rate is considered lower for people with Down syndrome, and that actually at a lower heart rate, the strenuousness of the exercises at a lower heart rate is comparable to the strenuousness of an exercise at someone else's higher heart rate. And so there's actually a formula for figuring out the target heart rate in people with Down syndrome that's a little different than in the rest of us, just based on the physiology and the neurology of people with Down syndrome. So again, real important. The long and short of that is we really want to encourage people to be active. We want to get their heart rate up. Again, maybe not quite as high as somebody else. We want to get them moving. We want to make sure it's a program with a variety of different types of exercise to help optimize our health and the health of individuals with Down syndrome. Really make it a priority. We encourage people to make it a priority. Build it into the schedule. Build it into the calendar. We see a lot of people with Down syndrome. Once they've built it into a calendar or a schedule, they are very faithful, and they really follow through better than a lot of the rest of us. So calendars and schedules can be really a very positive thing for many people with Down syndrome. Some people with Down syndrome have a harder time. Again, probably some of it based on the function of the autonomic nervous system, the part of the nervous system that we don't think about, works a little differently in people with Down syndrome. So some people with Down syndrome do better to break exercise into shorter periods. So, if you're shooting for 30 minutes a day, break it into 3 10-minute periods instead of one 30-minute period is sometimes helpful. And again, going back to the make it fun, listen to music or watch TV, be active with others, turn it into a game, make it a game. I mean, if there's, active basketball or soccer or whatever, do things that are fun. I've often said that, it's unlikely people with Down syndrome are like any of the rest of us are going to go down the basement and walk on the treadmill while the rest of the family's upstairs eating ice cream and watching television. So the other piece of it, I think that is so important is demonstrating or modeling this physical activity and this healthy behavior can have such a big impact on the individual with Down syndrome following your lead. So we encourage that as well. But make it a family fun outing. Put it all together with people, all together doing these fun things. So we're going to shift to sleep, and I think sleep often gets sort of left out of the recommendations of the picture, and unfortunately, because sleep has so many positive impacts. So let's do another poll. My biggest concern about sleep for my loved one with Down syndrome is he or she has trouble falling asleep, wakes up frequently throughout the night, sleeps during the day and is awake at night, has difficulty with sleep apnea treatment, other or no concerns. Give you a couple more moments here. And then the Oscar goes to, I'm sorry, the polling results are, so let's see, they're pretty spread across, but about a third have no concerns, which is great. That's wonderful to hear. The others are pretty, sleeps during the day, is awake at night is actually not a common issue of this audience. Wakes up frequently through the night, about a fifth. Trouble falling asleep, about 10%, not quite 10%. And then difficulty with sleep apnea, about 16%, not surprising. So let's dive into those. So sleep is so important. It's restorative. Clearly, we feel physically restored after sleep, but it's so important for our brain as well. Just reading the things that happens in our brain while we're sleeping, the toxins, if you will, the things that are cleared out of the brain naturally through sleep are so important. The brain is very busy, if you will, at night while we're sleeping, healing itself and repairing itself. Um, and certainly we'll talk, I think here in a second about, we know that poor sleep in people with Down syndrome or untreated sleep apnea, should say, in people with Down syndrome is associated with Alzheimer's disease. So we know that poor sleep has some very negative effects. It helps with learning and creating and creative problem solving. Our brain processes things, puts things where we're going to be able to get back to them at a later time when we need them. And this goes on when we're sleeping. It improves our immune health, helps us fight infections, if you will, improves the body's use of blood sugar. Poor sleep is associated with more difficulties with diabetes or higher blood sugars. It controls our appetite. If you're tired during the day and not sleeping well at night, you're more likely to eat more. And again, a lot of this has not been studied in people with Down syndrome per se, but again, we have no reason to suspect that much of this does not extrapolate well to people with Down syndrome. And then mental health benefits. People with mental health challenges have difficulty sleeping, and people with sleep problems tend to have mental health challenges. So, we really want to make sure we're addressing both of those when appropriate. And then again, as I mentioned, Alzheimer's disease. And again, this one has been studied in folks with Down syndrome, that we know that, again, untreated sleep apnea is associated with earlier or more pronounced Alzheimer's disease. So really very important to address sleep and sleep apnea in people with Down syndrome. So how much sleep? On average, about 7 to 9 hours. We certainly have individuals we see at our clinic that sleep more and really need that more sleep. And so it is individualized. Sleep hygiene. What is sleep hygiene? Really, it's developing a routine, developing habits that we kind of try to stick with as we get ready for bed, and as we get into bed to really try to help improve our sleep. And what are some of those things that we know? Going to bed and waking up at about the same time each day. Now, a lot of us don't do that on weekends, but it is actually recommended that 7 days a week we try to go to bed about the same time and wake up about the same time if possible, because that is a routine that our body gets used to and improves our sleep. Setting up a good sleep space, and this one, really as 30 some years ago when the clinic was open, it wasn't so much of an issue, but now people without Down syndrome are watching TV, reading their tablets, and looking at their phone right as they lay in bed getting ready to go to sleep, and that really does alter our sleep, and that's true for people with Down syndrome as well. And so this has become a huge issue in our practice, trying to encourage people to set those things aside ahead of time, 30 to 60 minutes before bedtime. Again, establishing this bedtime routine. Again, we have a number of visuals on our website that you can kind of plug things into. I'm going to pick the 5 or 6, 7 things that I'm going to do each night before I go to bed, and that routine is sort of a soothing, but also sort of a setting the body's preparation for going to bed. And so I'm going to brush my teeth, wash my face, use the bathroom, put on my pajamas, whatever the 5 or 6 things that are important or necessary for your loved one with Down syndrome, and then you can put them on a checklist and then sort of check them off, and that we really find that helps a lot of individuals with their sleep. Again, relaxation, reading or stretching or praying, drinking chamomile tea, etc., just before bed. Again, rather than using the tablets or the cell phones, the TV can be very helpful with sleep. And then avoiding sugar, caffeine, and alcohol before bed is also helpful. And for some people, the caffeine issue, for some people, really avoiding it after dinner. Some people, it's avoiding it after lunch. Some people, it's avoiding it altogether. And so really, caffeine affects people differently. And so really what works for that individual And then we have seen that for some people, the caffeine isn't keeping them awake, but it seems to be contributing to when they wake up during the night, they have trouble falling back to sleep. And so again, kind of looking at that can be important. The other thing I forgot to mention about the phones and the tablets, even during the night, if the light pops on, if it's next to your bed, studies have shown that that really can alter sleep. And so having the phone nearby, if you don't really need to have it nearby, or at minimum turn it over so that the light doesn't flash and alter the individual's sleep. Sleep aids can be helpful. Sound machines, earplugs, a sleep mask, a nightlight for some individuals is helpful. A fan, just again, a white noise. Lots of different things that can just sort of block out the sounds. For some people, using natural products such as melatonin or magnesium or valerian root or tryptophan can be helpful. Particularly for the magnesium, if a person has any sort of kidney problems, you want to be careful with that because that can be a problem, build up in the bloodstream in people with kidney problems. But those can be effective ways to help people sleep and again, non-medicinal treatments or non-medicinal approaches. Some individuals continue to have sleep problems, and we talk about sedatives or the medication trazodone, which is an antidepressant. About 6 months ago, I read a study in people without Down syndrome that trazodone was not an effective sleep aid in the non-Down syndrome population, but we really have continued to find that it can be helpful for the individuals that we see. Again, it's an antidepressant that we don't typically use as an antidepressant because we don't find it that effective, but we have found it effective for sleep. And then again, sleep apnea is very, very common, unfortunately, in people with Down syndrome, and that's particularly obstructive sleep apnea, where the brain is telling the body to breathe, and the body's doing all the right things, but the airway closes, and so during breathing, and so while sleeping, and so the air doesn't move back and forth the way that it should, and that's related to decreasing oxygen levels in the body as well as altering the typical sleep patterns that are so beneficial for us. So some people only really have sleep apnea if they sleep on their back. So changing the sleep position, using devices that help keep the individual off their back. Weight loss can be beneficial. There are data in people with Down syndrome as well as in others that being overweight and obese can contribute to sleep apnea, and losing weight can benefit it. Now, there are unfortunately, some people with Down syndrome, even when they're trim and not overweight or obese, still have sleep apnea. And so weight loss probably in that situation probably would not be that beneficial. But for many people that are overweight or obese and have sleep apnea, weight loss can be a real benefit. Many people end up using positive airway pressure, and that's like CPAP or BiPAP to help keep the airway open while sleeping. And now there's the hypoglossal nerve stimulator, also called Inspire, which is a device. It's sort of like a pacemaker that's surgically implanted in the abdominal wall, with one lead going to the diaphragm and one lead going to the hypoglossal nerve, which stimulates the tongue. And so as you breathe in while you're sleeping, it stimulates that nerve, and the tongue pushes forward and opens up the airway. And then as you relax between breaths, that your tongue goes back in. It goes in and out all night long. You can turn it off and on. You turn it off in the morning and turn it on at night, fortunately, so you don't, it's not making you stick your tongue out all day long. But it's an effective tool, and it has been demonstrated in studies, research, that it can be very beneficial for people with Down syndrome. There are some medications for people that are still sleepy despite being treated for sleep apnea. There are some medications for that. There is just in the last few weeks, tirzepatide, which has been getting a lot of interest in, because it's a medication that it still is prescribed for diabetes, but is also now being prescribed for weight loss. It's also called Mounjaro or Zepbound. And there was a study came out just in the very recent days that demonstrated that medication is actually helpful for people with sleep apnea. It seems like the benefit is from the weight loss. Again, weight loss being associated, or being overweight being associated with sleep apnea. So it seems like the benefit to that medication it mirrors the weight loss. And so the benefit seems to be from the weight loss rather than some sort of direct effect, as best as we can tell at this point. But again, that was just recently FDA approved for sleep apnea. So that's another possibility. And then there was some medications, two medications, armodafinil or modafinil, and then also oxybutynin, which again have not been approved for sleep apnea, but have been shown in the non-Down syndrome population to have some benefit for sleep apnea. So there are some new things coming down the pipeline. Unfortunately, just as in the rest of the population, a lot of people with Down syndrome struggle using the positive airway pressure, the CPAP and the BiPAP, but many do successfully. But there are some other possibilities here now and coming down the pipeline that might be things that could be used to help with the sleep apnea. And I misspoke. The two medications together that were shown in people without Down syndrome were atomexetine, which is also called Strattera, and oxybutynin. And so those are the two medications that have been used in sleep apnea in people without Down syndrome. And I know there's actually a study going on in people with Down syndrome now. And again, these other medications. So more to come on that. And I think that certainly at some point will deserve its own presentation all on its own, since there's so much new information coming down. But for those with or without sleep apnea, again, looking at the schedules and the sleep hygiene, a lot of visuals we have on our website that can be very helpful and can be turned into checklists. And we find a lot of the individuals we see find these to be very helpful to help them with their routine and get sort of settled down for bed. A lot of our folks like to use an alarm or a calendar reminder for when it's time to start getting ready for bed. So again, try to keep yourself on a schedule. And again, as I mentioned, don't keep the phones or tablets or computers in the bedroom if at all possible, and turn off the alerts and minimize the impact of the blue light that comes from the phones that can disrupt our sleep. So let's go to the next topic and jump into stress management. Now, for years, and when I'm talking about physical health problems, one of the things that people with Down syndrome rarely have is hypertension or high blood pressure. And inevitably, somebody will ask, well, is that because people with Down syndrome don't have stress in their lives? And the answer to that one is clearly no, that's not correct. There's a different reason why they don't have high blood pressure, but people with Down syndrome definitely have stress in their life. And I like to say that it may be that they, perhaps they don't pay the rent, have to worry about paying the rent or the mortgage and paying the electric bill or whatever the case may be, although certainly we have individuals that do those things. But there are other stresses. And I always like to say that stress is in the eye of the beholder. And so just because a person with Down syndrome finds it stressful and I don't, doesn't invalidate it. And so stress is such an important thing to consider. So
we can do.
I want to just tee up. This is really probably my all-time favorite video that we have. Cindy talks about stress and how she manages stress, and then how she would sort of describe stress in her life.
All sorts of stuff to make us feel less stressed, of course. I love to color in my coloring books. That makes me easygoing. It takes the stress away. And sometimes I also sit and close eyes and listen to whatever music to keep myself calm. Now listen up real hard, and you've got to exercise so you can calm down on that. Do any type of exercise like yoga, Zumba, dancing, or do whatever is exercise. You've got to.
So Cindy, we had a script for that, and Cindy went off. Much of it was off script, and it was much better because she went off script and used her own words. And so it was just a wonderful presentation. So she and the other lady give us a lot of good suggestions on ways to manage stress. I encourage you to look at it. I always think of the coloring, for many years, families and people with Down would come in and say, he or she likes to color, and is that age appropriate? And I said, if they find it relaxing, I think that's fine. And then the rest of the population caught up at some point with people with Down syndrome, and adults started coloring for relaxation. So people with Down syndrome were well ahead of the curve on that one. So what is let's do another poll. My biggest concern about stress for my loved one with Down syndrome is he or she struggles with communicating when he or she is stressed, does not know healthy strategies for managing stress, knows healthy strategies for managing stress, but has difficulty using them in the moment, other, and no concerns. All right, a couple more moments. All right, Laura, you want to do the unveiling? Well, this one has a pretty clear winner, if you will. Struggles with communicating when he or she is stressed. And so I encourage you to take a look at that video, because Cindy gives a lot of her thoughts on that, and some ideas that you might be hearing, but aren't necessarily clear that that's what the person's communicating. And then about a fifth knows healthy strategies for managing stress, but has difficulty using them in the moment. Came in second there. So let's talk about stress in the lives of people with Down syndrome. So first off, we think that people with Down syndrome have what we call empathy radar, and that's a kind of a sense of other people's emotions and feelings, and so they can sort of pull that into themselves. And so if there's a lot of anxiety around them, they might become anxious. Now, the one study I found on this suggests that people with Down syndrome don't have any greater sense of what's going on around them than others, but they have a more likely to act upon it or share. So if they're feeling anxiety, they're more likely to share that back. I'm not convinced of that personally. They don't have a greater sense, but we'll take that study for what it is. But clearly, people with Down syndrome seem to respond more to the stress and going on around them. On the upside, if it's happy things and joyful things, they're going to respond to that as well. And then what we call the pace. The world moves pretty fast, and a lot of us find that stressful. And for some people with Down syndrome, that is just too much, and they really can't deal with the pace of the world, and so their only response to that they have found is that they just slow down, and they're not going to move fast. They're going to go at a pace that they're comfortable with, and the rest of us could just either slow down or forget it. And so you see that's an issue. We do know that anxiety is a significant problem in people with Down syndrome. About 17% of people with Down syndrome have been shown to have anxiety, and almost half of those that have anxiety have obsessive compulsive disorder with anxiety. So their obsessive compulsive disorder and anxiety are linked, and about almost half of the people with anxiety have obsessive compulsive disorder as part of their symptoms. And then we also know that depression is almost 10% of people with Down syndrome. So we know that's a significant problem as well. And certainly, so really trying to look at managing stress to help limit or prevent these conditions is important. But other health conditions as well. We know that stress can cause a lot of health issues. And again, to go back to the poll, it can be hard to identify what stress feels like, or what I have the person share what they're feeling. So you really want to try to identify emotions, if at all possible. And we do know from mental illness that a lot of people with Down syndrome don't necessarily report symptoms as much as they have a change in behavior. And so we really want to look at what is going on. If we're seeing a change in behavior, how might there be a stressful situation, and how do we address that? So that just as you in the poll, you reported that it's hard sometimes to know what the person is finding stressful. At least the change in behavior gives you a clue that something is going on. Identifies triggers. What are the causes of stress? Use some strategies. And again, some folks commented that the person knows some strategies but has difficulty using them in the moment. And so I was using this analogy the other day with a patient. I said, she's very sports minded, and I said, you practice soccer or you practice basketball ahead of time, and so you really kind of, so when you get to the game, you're ready. It's really second nature. And so that's what we really encourage with these strategies as well, to practice them ahead of time, to use them proactively, even to do them each morning, to kind of get the day started off on the right foot. And then when you do get in that situation, know that you can pull them out and use more likely to use them. If you're just trying to use them for the first time at the moment, it's much less likely to be successful and much less likely you're actually going to be to pull them out and to use them. So counting to 10, taking deep breaths, walking away, and the coloring, all can be helpful things. Reframing thoughts and asking for help and using I statements. We have a lot of good information about this on our website. I encourage you to take a look at that information that's really designed for people with Down syndrome. And then prepare for life changes. Obviously, some things you can't prepare for. People get ill, people die, things happen, that we can't necessarily prepare for, but a lot of things we can. Transition out of school, moving, staff changes. How can we help people prepare for those ahead of time as much as possible? And again, we have a lot of good information on our website about that. Model, we talked about modeling before for physical activity, modeling stress management. You can say, I'm very busy and feeling stressed. I'm going to take a deep breaths to help you feel better. So model things that you do to reduce the stress in those difficult times, and do it in front of the individual so that they can see that you're finding ways to reduce the stress in your own life. And again, we have a lot of visuals that can be helpful. And again, practice them during times that are not stressful can be very helpful. So let's go to the next one. It's meaningful activities and social connections. And so we'll do another poll. My biggest concern about meaningful activities and social connections for my loved one with Down syndrome is he or she is too busy, lacks access to opportunities, does not want to participate in activities, other or no concerns. A few more moments there. Lori, you want to show us what we got? So about a third does not want to participate in activities. And about a quarter lacks access. Too busy, about 8%, other 12%. And really no concerns, about a quarter. That's great to hear. That's wonderful. So let's take a look at that. So meaningful activity and social connection, certainly they're part of the joy of life. It gives us things to do and that are fun and interactive, and it helps us in developing relationships. But there's a lot of health benefits as well. It can help with cognition and memory. In the non-Down syndrome population, it's been shown that hearing impairment in older people, hearing impairment in older people can actually reduce socialization, which can actually increase the chance of getting dementia or Alzheimer's disease. So it really has important health issues. Helps us maintain skills and mental engagement, certainly mental health benefits, and again, the Alzheimer's issue. And really a wide variety of things, jobs, but paid or volunteer, but hobbies, relationships, building community in a lot of different ways. And again, encourage you to take a look at our webpage. We have a lot of information on there. And again, prepare for changes in advance. When a sibling's going away to school, plan a weekly phone call. Now that we have, FaceTime and Zoom, great way to interact with people. People with Down syndrome do tend to be more visual than audio, and so really using that to an advantage. Support changing interests. As people get older, interests change, just like the rest of the population. And so really looking at that over time is important. And then again, keep coming back to this and using calendars and visuals, so helpful. My visual is constantly my phone, and whatever the visual that individuals use is so important. And then lastly is social skills. And this one is so important. Over the years, we have seen so many people with mental and physical health issues because they did not have the social skills to take advantage of being out in the community and being independent and having opportunities at work and things. So social skills or lack thereof can have a very significant impact on health. So let's do one more poll. My biggest concern about social skills for my loved one with Down syndrome is communication skills, understanding boundaries, managing conflict, social media, other or no concerns. All right, a couple more seconds. All right, Laura, what did we learn? So not unexpected, about 40%, 4 out of 10, roughly communication skills. And that we know that's an issue for a number of folks with Down syndrome. And then understanding boundaries and managing conflict are also pretty common. And then social media, other and no concerns. Interesting on this one, no concerns is the lowest number. So this obviously has hit not only that I certainly find it an important issue, clearly you do as well. So social skills are essential for successful relationships and community involvement. Really, they're learned skills. For some of these, they don't come as naturally to people with Down syndrome. So we really have to really focus on making sure we're doing the education. And a lot of times, people had training, if you will, in school or when they're children, but the rules might have changed or they may have forgotten. I don't mean the rules have changed in general, but rules do change as we get older. I mean, what was socially, acceptable for a 5-year-old is not typically socially acceptable for a 35-year-old. So, and that's true for individuals with Down syndrome as well. So it's really an ongoing learning process. And again, lack of appropriate social skills leads to embarrassment, disagreements, being reprimanded at work or school, losing a job or friend. We say that, of the individuals we see that have lost their job, it's very rarely because they can't do the job. It's typically because of some social skill issue, and it becomes so important in the job arena as well. So learning social communication, boundaries, public versus private, flexibility, problem solving, conflict management, compromise, navigating social media, all these things are really important, and all these things. Dr. Frank and our team have put together lots of information. We have social skills training groups as well as that are online now primarily, and as well as lots of information on our webpage we encourage you to take a look at. Friendships, one way and two way. I like you, but I like him, but he doesn't like me. What are the implications of that? Rules for conversations, how to compromise, all those things are so challenging. I think a lot of us, we struggle with some of those things as we go through life. And certainly people with Down syndrome do as well. And so how can we help them? We really feel like a lot of folks with Down syndrome, most can learn these things if given the opportunity to learn them, but also to practice them. And that's such an important thing to have opportunity to practice. So final thoughts. People with Down syndrome can be active participants in promoting their own health, from physical to mental to social. Everyone's recipe for health is unique, and real keys to helping make it go or make it fun and start small. I'm not expecting to do all the 75, 200, whatever it was, number of things we talked about today. Pick a few and start with those. The recipe may change with age. Actually, the recipe will very likely, almost certainly will change with age. And then teaching and modeling are so important, and the role that others around the individual with Down syndrome can play, and particularly the modeling, are so important. Again, we have lots of resources. This is our website that's on the phone version, the portable version, but we have lots of resources by topic that's available on our website. We have video resources, lots of educational videos for people with Down syndrome, and those are all the actors and actresses have Down syndrome, or maybe another intellectual disability in some cases, but all the individuals with Down syndrome teaching each other on some of the healthy things, healthy ways to get through life. Our book, Mental Wellness for Adults with Down Syndrome, is available. It's unfortunately a year after it was published, the publisher Woodbine went out of business. And so we made it free, available on our webpage as a PDF. You can either read it online or download a print, whatever. And through generosity of the Matthew Foundation out of the Bay Area in California, as well as an organization in Spain, the book has also been translated into Spanish. So it's also available free online. And I feel welcome to take a look at that. If you have if you are a healthcare provider, or you have a healthcare provider you want to share more information with, we really encourage you to share the Down Syndrome Medical Interest Group, which is an organization that is really for healthcare professionals who serve people with Down syndrome. We have a number of opportunities on there for health professionals, including Project Echo, and we're someone that does not have access to a clinic, for example, the healthcare provider can share information anonymously about the individual with Down syndrome that they're caring for, and a group of experts in Down syndrome are on the Zoom meeting and can share suggestions with that healthcare professional. And then we also have a lot of references here that you can take a look at. These slides will all be available to you. And we'll take time for some questions. And Laura will do it through the Q&A, I believe, right?
Thank you so much, Dr. Chicoine, for sharing all that wonderful information. We have a lot of questions, so I'm just going to dive right in.
Great.
What do we know about weight loss medications like Ozempic and Wegovy in people with Down syndrome?
Yeah, not enough. The short answer. I think we're still learning. There are some people that have been able to prescribe them and have started to teach us about what they're able to find. The challenge we've had in discussion is getting them approved. So a lot of Medicaid in Illinois does not pay for these medications, and they're very expensive. So we have not had a lot of experience ourselves with them. But I think we're seeing that they certainly can work. They can have real benefits. And particularly the newer ones do have the potential for gastrointestinal side effects or complications. And we do know that people with Down syndrome, a lot of those complications or side effects are things that people with Down syndrome already have a tendency towards problems with. So I think we do want to be cautious and learn more. But I think there is some opportunity there going forward for those to be part of the overall management of weight in people with Down syndrome.
Thank you. What do we know about cholesterol and the use of statins in people with Down syndrome?
Yeah, great question. So we know that atherosclerosis, hardening the arteries or plaques in the arteries, that is related to an elevated cholesterol and other factors. And we know that atherosclerosis is much less common in people with Down syndrome. And so what is the benefit of a statin in people with Down syndrome when you're lowering the cholesterol? It's less clear than it is in other people. Not so less clear that the recommendation is to never even consider it. The recommendation by the global adult guidelines is that at age 40, it's recommended starting every 5 years to check the cholesterol or the lipid panel of people with Down syndrome, adults with Down syndrome. And then taking that information and the weight and the family history and the smoking history, et cetera. And there are calculators, if you will, formulas, and there's apps for this that the provider can, or you can find them yourselves as well, non-providers. But anyway, you can put all this information into the app and into the calculator, and it generates a number. So it generates a number. What is your risk of developing heart disease or developing heart problems in the next 10 years? And the general thought is that if that number is less than 7%, or in some cases people talk about less than 10%, then a statin would not be indicated. And so we've been doing that based on the guidelines. And I would say it's pretty rare that we have someone with Down syndrome that actually ends up having fits into that where they would actually then need a statin. So I would say that it's probably less necessary. I would not say that it's never necessary. And certainly in consultation with your own healthcare provider, particularly your cardiologist, if you have a history of heart disease, to decide what would be appropriate for you. But the short answer would be that the benefit would seem to be significantly less in people with Down syndrome than it would be in other people.
Thank you. You mentioned that we don't know a whole lot about the effect of artificial sweeteners, or we need to know more. Any comments specifically about crystal light?
Yeah, you see conflicting information in the non-Down syndrome population, and I don't think there's any information that I've ever seen in the Down syndrome population. So I, I, I'm if you wanted to eliminate it completely out of your life, I would certainly not have any concern. I mean, there's no real benefit to it. I mean, other than the potential that it can help with weight, although that's really not seems to be demonstrated over time that, our population keeps getting heavier and heavier, even despite those being around. Whether there's clear negative effects, I think that's still being debated. I think some studies show there are, and some studies show there's not. What are the effects on people with Down syndrome? We just have no information to go off of, unfortunately.
Thank you. We had some questions about some of the medications that you referred to. We can connect and I can share those in the follow-up email to all attendees. And then also about the target heart rate articles or research that you mentioned.
Sure, we can put that in there, yeah.
Okay, wonderful. Thank you. Is there such a thing as too much sleep?
Yeah, that's a great question. Again, it wasn't had to do with Down syndrome. Just last week, I was reading an article that suggested, too much sleep can also be a health factor for us. I think perhaps even more than what is the effect of too much sleep is why is the person needing so much sleep. And one of the things I would think about is sleep apnea in people with Down syndrome. So even if they're sleeping long stretches, if they have untreated sleep apnea, it may not be quality sleep, and so they may still be tired, and that's one of the reasons they're sleeping. We know thyroid problems are more common in people with Down syndrome. Depression is more common in people with Down syndrome. That can contribute. So I'd really want to go, particularly want to go back and look and see, is there an underlying reason why that person is sleeping more? I think would be the first thing I would really take a look at.
Thank you. Are there any vitamins or mineral supplements that you recommend for people with Down syndrome?
Yeah, I think that for me, the first approach really is we'd want to make sure that the diet is healthy. And the interesting studies that are now showing, and I think it's I know that it's been demonstrated in people with Down syndrome as well. Even some people that are overweight and obese still are lacking some vitamins and minerals. And so, and that's in the diet. So I think the main thing is you really want to look at making sure that the diet has all the appropriate nutrients in it in addition to the calories, or instead of the calories in some cases. But as far as specific, I don't think there's anything really specific for people with Down syndrome. I think, vitamin D, I think certainly has gotten a lot of press, although there's been a lot of concern that maybe there was too much concern about vitamin D. But I think, we certainly see that, some concerns about the bone health of people with Down syndrome. So I think having enough vitamin D, I think would be important. We do know that vitamin B12 deficiency is probably more common in people with Down syndrome. So considering whether that is something that you'd want to measure and supplement if appropriate is certainly something to consider. I think our whole information about folic acid, I think, is still limited in people with Down syndrome. I think there is some concern about the difference in the way that's used in people or metabolized in people with Down syndrome, but I don't think we know enough to make a specific comment about folic acid supplement at this point. So generally, I personally, my first step to answer that question is go see a dietitian or a nutritionist and look at the diet and make sure that we're doing everything we can diet first before we consider supplements. And then the dietitian and nutritionist, if there's some areas that are just still lacking, that they can help you with fitting that in with filling the gaps in with the supplements.
Thank you. Would you mind commenting on calcium specifically?
Yeah. Boy, that's a tough one. I think that the benefits of calcium supplement is, again, even goes up and down in with different studies in all of us. and how much we should get. Is calcium supplement beneficial? I think that's still sort of a, I would say, an unclear area, and the potential that there may be some downsides to getting too much calcium is there as well. Certainly, I think calcium and bone health has been a concern. So I think making sure if you can do it in the diet, making sure you get enough calcium, the recommended amount of calcium and not going, you know, way over that, I think is a reasonable thing. I know there was a lot of discussion in the past about osteoporosis or thinning of the bones in people with Down syndrome. But the more we learn about osteoporosis in people with Down syndrome is that the DEXA scans that were used in those studies and are typically used to determine osteoporosis may not be accurate in people with Down syndrome. They may actually overcall osteoporosis, so they may underestimate the density of the bones in a person with Down syndrome. Actually, in people that are shorter in general. And so the whole question of whether osteoporosis is more common in people with Down syndrome is really unclear at this point. And so in the global guidelines, the recommendation was that the guidelines really could not recommend for or against osteoporosis screening, for example. There really just isn't data to tell us what the right thing to do with that at this point. So it sounds like I'm sort of copping out on the answer because we just don't have the data to tell us what's correct. So our approach is, if at all possible, look at the diet. Can we get, the recommended amount of calcium in the diet as a starting place, and then, not looking to give large supplements because, again, we know there are potential downsides to being on too much calcium as well with regards to the potential for kidney function, kidney stones, and other things that can be a negative with too much calcium.
Thank you. Is a sleep study recommended even if there are no overt signs of sleep apnea?
Yeah, that is a wonderful question. I wish I had as wonderful an answer, but that's a wonderful question. So in kids, in the American Academy of Pediatrics healthcare guidelines for children, I believe it's age 3 or 4, I forget. It's recommended that all children with Down syndrome get a sleep study in the first 3 or 4 years of life. There isn't a comparable recommendation for adults at this time, although what I'm calling the next round of the global adult guidelines, that is being looked at. So that's still the research is still, previous research, available research is being reviewed at this time, and over in the next year or so I'm one of the people in that group that will be looking at all that data and come up with a recommendation. So that isn't available yet. Hopefully in the next few years we'll have that recommendation. It is clear from children with Down syndrome, and again, I'm not aware that this study has been repeated in adults, but it's clear from children with Down syndrome, parent observation of their son or daughter's breathing does not correlate well with the sleep study. Now, that doesn't mean parents are bad observers. It just means that people with Down syndrome can have really no outward appearing signs and can still have sleep apnea. So the sense would be that's probably not a bad idea that everybody with Down syndrome get a sleep study. That recommendation has not been made yet, but some form of that I think is coming. But we'll see. So our approach again is anything that's, mood changes, mental health changes, behavior changes, otherwise other health changes, all of that, things to consider with regards to could be caused by sleep apnea, because sleep apnea does cause so many problems. And so that we'd want to be looking at potentially doing a sleep study to figure that out.
Thank you. Also on sleep, what do you make of the sleep data from smartwatches or Fitbits or things like that?
Yeah, I've not seen that's been studied in folks with Down syndrome, and maybe it hasn't, I missed it, but what I've seen in the non-Down syndrome population is that it's some information, we'll say. Not great information. It's some information, but it doesn't appear to, it's certainly not information that I would make a medical decision on. Obviously there's the ones that can tell you if you have atrial fibrillation or some heart rhythm, that one I certainly wouldn't ignore if my smartphone is telling me or my smartwatch is telling me that. But I certainly wouldn't prescribe a medication based on what the watch is telling you. I would certainly follow that up with additional information.
Thank you. We've received several questions about individuals who are still struggling to get back out following the pandemic. Can you talk about that, please?
Yeah, I get it. I mean, I understand it completely. We've seen it ourselves many, many times. I always say that, March 15th or whatever it was of 2000, where the world suddenly stopped in a day, that was pretty obvious. Because the schedules changed and everybody, life was so upended. But coming back out is also a lot of people got sort of used to their new groove, their new regimen. And so now coming back out is challenging. So, really helping the individual establish new routines, and changing routines. We have information on, Dr. Frank and I gave a talk on the groove on our website. I encourage you to take a look at that. Dr. Frank gives a lot of good thoughts on helping people establish new routines and new grooves. And I encourage you to take a look at that. I think that's really helpful. But you are not alone. It has been a huge, huge problem, in people coming back. People. It was interesting. There was a New York Times article about a year into the pandemic that I saw that said that we're in a sense we're all grieving the loss of our routines. And I'm reading the article thinking, oh my goodness, if that's true for all of us, what about a population that, to a great extent, thrives on routine? People with Down syndrome. In a very positive way, but then when they're upended, it can be a real challenge. So, so that you are not alone. That's a real issue, and again, so really trying to help people establish some new routines, healthier routines is really important. And Dr. Frank gives a lot of very practical information in that video.
Thank you. Oh, I wish we had another hour. We have so many good questions. I reiterate what Dr. Chicoine said. Please take a look at our resource library because there's information that responds to a lot of these questions. One of the questions in particular was how to find a provider, and we do have a Q&A on that in our FAQ section. There are some links to identify providers and clinics in the US. But unfortunately, we are out of time. Dr. Chicoine, if you could go to the next slide, please. We are able to offer these webinars because of the support of generous donors. And if you would like to support our education efforts, such as these webinars, we would appreciate if you would take a look at our giving page linked on the slide. So thank you so much for joining us. And Dr. Chicoine, I'll leave it to you for any final comments.
What a pleasure I wish we could be with you physically, but what a pleasure to be with you today, virtually at least. And have a warm day. Where you are, not so warm here, but have a great day. And we look forward to seeing you hopefully at an upcoming conference someplace.
Thank you.